The webinar will begin shortly. Please remain on the line. The broadcast is now starting. All attendees are in listen-only mode.
Hello everyone and welcome to today's Mondac webinar in association with Gün Partners. My name is Dan Sampaio. We're joined by two wonderful panelists today. Selin Sinem Erciyas is a partner at Gün Partners who specialises in life sciences and intellectual property with special focus on patents and utility models. I will hand over to Selin in a moment to introduce our second esteemed panelist. But before I do, a housekeeping item. Submit questions to our panel by typing them into the questions pane of the toolbar on the right-hand side of your page. They will endeavour to answer as many questions as possible during our Q&A session. Now, my pleasure to hand you over to Selin to begin. Thank you.
Thank you, Dan. Well, good afternoon, everyone, and welcome to our webinar to celebrate World Intellectual Property Day. Well, WIPO chose a wonderful theme for this year, creative and innovative human. And we're celebrating the can-do attitude of human inventors this year. Our guest today, Professor Rana Sanyal, is just the right person to celebrate the can-do attitude of human inventors in Turkey. But before introducing Professor Sanyal, I'd like to underline a few statistics from 2022, which made us all very proud. Well, according to WIPO data, the number of Turkish women inventors of international patent applications in Turkey has increased from 17.8% to 34.2% in the last decade. The data given in the PPT Yearly Review 2022 report of WIPO shows that Turkey ranked in second row after Spain with 24.2% women inventor in international patent applications. Well, among these women inventors, my guest today, Professor Rana Sanyal, has a very special place as one of her inventions is the first candidate for a new medicine developed in Turkish laboratories and reached patients in clinic. Her startup company, RS Research, clinically validated drug delivery technologies are protected by multiple patents across 12 regions and in 58 countries. The company's invention, Believable Polymer Drug Conjugates, received the Grand Prix Award in ISIF 2022 National Innovation and then was granted with silver medal in IESA 2022 International Trade Fair for Ideas, Inventions and New Products in Germany. Well, as you may understand, today I'm more an interviewer than a speaker or a panelist, and I'll do my best to give the opportunity to Professor Sanyal to tell us about her past. I would like to say welcome, Professor Sanyal, first of all, and I really appreciate that you could make time for us. I know that you're attending a conference right now. You're in Switzerland. Still, you accepted our offer and to be with us in this webinar. Thank you very much. I also should say that I know you very well. Of course, we cooperated in patent projects in the past, but could you tell us a little bit about yourself and share the startup story of RS Research for our audience?
Hi, Selin Hanım. It's a great pleasure for me to be here with you, talking about IP, talking about my research, talking about everything we have been doing in RS Research also. So I would like to first apologize for the background noise we have on the background where we are. I'm at a conference hall with like so many things going all around me right now. I couldn't find a really quiet place at the moment, but this is the quietest it gets around here. It's a biotech event that I'm in, so I'll first apologize from all of the audience members right now for the background noises that might happen also in the next hour or so. So first, a little bit about myself. My undergraduate education was chemical engineering, and then that was in Istanbul, Turkey, Boğaziçi University. And following that, I did PhD in organic chemistry in pure sciences, from engineering to science, in US, Boston University. And then I worked at a biotech company, Amgen, in US. And after 10 years in US, I came back to Turkey, Istanbul, started as an academician in Boğaziçi University, Department of Chemistry. So started a lab doing research on targeted drug delivery. That research kind of led to, advancements on new molecules that were coming up. And some of the data looked too good to, go waste on some publications. So we wanted to advance them to human. That is when we started the company in 2015 with my co-founder Sena Nomak. So we started the company trying to move our candidates to clinic. And finally, now in the last couple of years, we have been in clinic. And we have many more molecules now coming up in the pipeline of the company, trying to move things. Yeah, you will see the background. I'm right next to the kitchen. Sorry, this was the quietest place. So we are now trying to move more and more molecules into the clinic and trying to make impact in people's lives.
Yeah. So I really would like to learn much more about what is the main focus that you are working on at RS Research right now, especially the subject matter of the inventions in your patent applications. For example, which disease can your patented technologies be used for treatment?
So we are working on targeted nanomedicines for oncology. Classical chemotherapy, let me start from there to be able to explain you the inventions. Classical chemotherapy is almost like shooting blindly at a tumor, just hoping that you will get some of the bullets into the tumor. But then in the meantime, you are really damaging the rest of the body. So those are all the toxic events that are happening, all the side effects that you see in patients when you apply classical chemotherapy. More recently, there is the targeted therapies. I'm sure the audience have heard about them. So it says these targeted therapies says, let's not shoot at the tumor, but it's almost like a wild animal. Let's tame the tumor. Let's find something that when it go wild, and let's tame the tumor. So that is also targeted therapies, again, within the last 20 years or so that has been coming up in the market. I would say, yeah, almost 20 years now. So even the newer version, the next generation, is again, instead of trying to tame the tumor, we again go and kill the tumor, but only kill the tumor, as opposed to shooting everywhere. The magic bullet idea, of course, this is also very long, back in the history, but the magic bullet that it is going to go only into the tumor, instead of shooting the entire body, we send the bullet to the tumor only. So to guide the bullet into the tumor, what you need is a carrier, so that you are not really damaging everywhere. And depending on what you want to carry, you can use different carriers. And this is what our patents are all about. So we have different carriers, and the patents are really not just for one molecule or one medicine. They are platform patents that are trying to protect these carriers. So different carriers for different molecular entities. You can deliver many different drugs with these platforms. So that's what the patents are about.
Yeah, so you save the healthy cells or the healthy parts of the patient by this way, right? So you're not harming entire, Well, as I mentioned that, introduction, your invention is the first candidate for a new medicine developed in Turkish laboratories and reached patients in clinics. So maybe you can tell us more about what was the biggest challenge in this breakthrough, and maybe if any, what was the disadvantages of being the first to develop a new medicine candidate in Turkey?
Of course, you can apply for a patent. It can get granted, but the real value of a patent is when it has its impact, that it really, you make something from that patent. Otherwise, patent is just a piece of paper that you own it, but it really does not have a value if you haven't applied for anything, applied it to the real world. And on the other side, I'm a basic science researcher. So for a basic science researcher to have a real impact on human life is also something, it's a dream. So you can keep writing patents, or you can keep writing articles on publications. And unless you actually go ahead and do something with that, that is, that's information. But the application of that information, what makes it really valuable. So in order to reach the clinic, I think the biggest challenge was in our heads in Turkey, that you keep hearing that you cannot do something, you cannot make a new medication, because this has never been done in Turkey, that from laboratory to clinic, we never did it, right? So you keep hearing that you cannot do it, you cannot do it, you cannot do it. Right? If you have, you also have young children. What do we always tell, parents? That you need to, you can do it, right? We cheer them up all the time. So if you keep cheering that no, you cannot do it, no, you cannot do it to people, they start believing in that. That is, I think that was the biggest challenge. So the more I kept hearing that no, it is not possible, we cannot do it here, I kept repeating myself that no, we can do it. So I think that was the biggest challenge of all. Other things are technical things, it just takes time, but going over the mentality was the biggest challenge.
Well, I agree totally, but I have to say this was not the answer that I was expecting to hear. I was ready to hear much more, solid obstacles in front of you, maybe. But you're completely right, of course. This mentality, of course, is the biggest obstacle. But I also know that you lived and worked in abroad, so you can make a very good comparison for us in terms of the research and development activities, what you've been doing so far, and maybe you can comment on what would be different in terms of the difficulties or easiness if you were to have carried out the same research abroad, let me say in UK or US, I don't know, name yourself.
In terms of the discovery, in terms of the things in the patent, I think that was simple. That could have been done anywhere. I'm not saying easy, but simple. The idea was simple. The idea wasn't really something complicated. So the idea was simple, not easy to do, but it was simple idea. The translation into clinic was neither simple nor easy. I would say it wasn't easy. The ecosystem was missing in Turkey, so we had to build an ecosystem around ourselves. In terms of the recent years, I think we have been lucky from one aspect. This is for the whole world. I don't want to say pandemic COVID was a good thing. We lost millions and millions of people, but it raised awareness everywhere, not necessarily only in US or Europe. You can actually develop vaccines in many other places in the world, right? There has been many developments. So that was an awareness that increased the can-do attitude, and the awareness that, research is not just something you do in universities and then you publish papers and then sit on it. Excuse me. So you can just your life can depend, a human life can depend on that research that is done. Pardon me. So that was an awareness globally. It wasn't just in Turkey. So that raise of the awareness that we can actually do something and that has an effect on people's lives, but by changing something and by discovering something that came through realization in Turkey as well, not just I think it was easier to see that because there has been many developments that are done from research labs to clinic to human lives in US and in many places everywhere else in the world. But in Turkey, we had not realized this. We had not really experienced this, not just realization, but we had not experienced this. So COVID gave us this example that this is doable. And this can have an impact on people's lives. So there has been many developments in Turkey during COVID as well. So that the adaptability of the system in Turkey is very high. I would compared to many ecosystems I have been around in the world, adaptation is very fast in Turkey. So whenever there's an obstacle, since we have so many obstacles in our lives daily, we don't really think about them too much. We just jump over those obstacles. We are used to jumping over obstacles. So the adaptability was very high. In terms of how I would do the same discoveries elsewhere in the world, sure. As I said, the ideas were very simple. They could have been done everywhere. But if I was developing a new drug in, let's say, US, I had the experience of that as well. I was very lucky that the molecules that I worked on went into clinic, were already being tried on patients. I think the satisfaction you get from that, I was just one of the thousands that who were doing such things in US. And if US didn't have Rana, nothing changed in US's life, right? On the other hand, it is just being, even if there are now 10 more molecules or drugs, medicines being developed in Turkey, I'll be one of those. I'll be still 10%. We are the first ones who managed this, and I'm hoping that there will be a lot more coming up, because now people see that it is doable. It wasn't not doable in the first place. Now that nobody can say, no, you cannot do it to anybody else. So it is going to open the road to many other discoveries being realized and making impact on human lives. So I think the impact that I have is not just on patients' lives, because I'm working in oncology field. We are developing drugs that are already in the unmet medical need area. So it breaks your heart to even cite those numbers of people who have passed away, the loved ones we have lost due to cancer every year. But it's not just the impact on cancer patients and their loved ones, what we have as a company, as a researcher myself, or as my whole team. It is the impact that we have on the clinical research area in oncology in Turkey right now. We do have a production facility in Turkey for such nanomedicines, and which is a very unique thing even in our entire region, from Eastern Europe to Western Asia. The entire geography does not have a similar production facility. So it's a very unique facility for these nanomedicines, because these are novel in the world as well. These are not, we are not trying to repeat something that has been discovered elsewhere 20 years ago. These are very new things. These are the upcoming novel therapies, targeted therapies in the world. So the production facility, I think, is going to have a huge impact in terms of how we make these things and how we can help other countries around us also to be able to produce clinical grade materials. And the biggest impact, I think, is on the researchers who are interested in making such discoveries. So that impact, the major impact that I think we have on the researchers, I think there was no need for such impact in US. That is already there. They have done it before. So in Turkey, I think the most satisfaction I get by doing it in Turkey is because we can actually move the entire ecosystem higher up with these accomplishments.
Yeah, so maybe something that could be seen by anyone else is the biggest difficulty, because lack of anything was a motivation for you, which is really, really quite a breakthrough job, I have to say. So you referred to your team. So referring to the team of the WIPO, I would like to ask, what is the ratio of women scientists or women workers in your team? Because I think I know the response, but I would like to ask, is it correct to say that you prefer to work with women scientists, or is it only coincidence?
I think the number is about 80% women. I don't think we specifically prefer women. We just select the best experts in the field to work with, honestly. And women are meticulous, I have to say, because in the work that we do, I think that's a very important characteristic. They can see the big picture clearly. That's a very female characteristic again. I'm not saying that men don't have. I mean, I'm sure there are a lot of men who are meticulous and who can see the big picture also. But these two are, you know, when I say women in science or women in technology, women in production, these two factors that come to these two qualities come to my mind immediately. So these are terrific qualities for to make them best in their fields. And women possess these qualities inherently. That's what I believe in most cases. So just while we are trying to pick the best people for our team, they get selected. So it's not, we didn't pick them because they were women. We picked them because they were best. So if you give the opportunity, equal opportunity, women do win. Most of the time, that's from one woman to another, who is very good in her field as well. So,
thank you very much. Well, you know that we are, I mean, the intellectual property practice group of our firm is also, I think, 95% of women. We have very valuable 2 senior male partners. We appreciate very much both of them. Yeah, I know, I do totally understand what you say when you say that we just pick the best one, and it is coincidentally women. We don't choose the women on purpose. But I also agree with you so much about the dedication of women, about their motivation, how they want to be successful, especially in our ecosystem, as you just mentioned, in the lack of many substantive things. The motivation of women are really, really high. I need to shift a little bit to the patent issues. Well, I know that patents have a very important place in your world when it comes to research and development, especially for a startup company. But I also would like to learn, if any, of course, the main advantages of patent protection of inventions in your work. What I'm trying to ask is maybe there may be some disadvantages as well. I cannot think right now. But where you put the patent world and the patent protection within your work, within your overall research and development?
So the way we are trying to develop new medicines is through something we call startup route. So the way the world has evolved in the last 20 years, and even in the last 10 years, even more so, is startups do discover the drugs. They even move them to phase 1, phase 2, phase 3, even very recently all the way to the market. And then the large companies do acquire the molecules in much later stages, and sometimes even the small companies are moving them. In terms of cost, it is about 1/6, 1/7 per what startups develop the drugs for in terms of how much it is costing is much less compared to the large companies development. So these are industry-wise known numbers. So from this information, what you try to do is you don't start a startup with your own funding, with your own money, but you start getting investors' money, to some venture capitals, and they take a risk on you. They believe in you, the science, the technology, the promise that you tell them, and they invest in you. And when they're investing, of course, there is this risk to benefit ratio. These are not scientist people. These are the money people that you have to convince to invest their hard-earned cash that you are worth it. So the way it works is eventually you have to show them you can commercialize this. Whatever you are telling them, the promise, the story, the health, the sustainability, the environment, the story that you are talking about has to become commercial and earn money at the end. So in the field of biotechnology, pharmaceuticals, patents are a must. If you are not protected by a patent, then you cannot be selling it in a country, because the development cost is a lot for both fields, for biotechnology, pharmaceutical technologies, everything. So the amount of investment that you have to do to develop that, it's not just the production cost of your material. The research cost is very high. So to be able to eventually sell your medicine in different countries, you have to have patent protection in those countries. Otherwise, that will not be feasible to produce and sell them anywhere. So to have an investor invest in you, which is again a must for a startup to survive, to go through all the motions of developing a new medication, then you have to have IP production. I don't see any negative points, just like you said, other than the fact that it is expensive. To apply in many countries. It is time consuming to get to the patent protection. But once you have your patent protection, I don't see any disadvantages of that. You can actually apply it in many countries and then be able to sell your product, have your IP protection in many places all over the world. So I think it's a positive thing.
Yeah. But for example, now I'm thinking when you're talking about the importance of patent protection, especially when developing new medicines, I know that there is this crucial timeline to, file the application with the most accurate scope possible. You may have heard about the recent EPO decision, about the plausibility, about the post-published evidence, etc., which makes me think that you as a scientist, you are thinking that, well, I'm developing something, but what is the right time for me to file the patent application, etc. So I assume that you have a set patent strategy in your company, maybe a patent team to protect your inventions in the most effective way. Is that so, or how do you direct your patent applications or strategy within your firm?
That's, I think, a very crucial point you raised. Timing is very important. So drug development takes a long time. It's different than any kind of other engineering patent application, for example. So if you apply your patent really early when you have the idea, you jeopardize the amount of time you will be in the market. So the number of years out of your 20 years of patent time, you spend easily about 12, 13 years of your time in the development, in the development time frame. So by the time you reach the market, you have always less than 10 years. So if you are really in a hurry and you apply for your patent, for your invention protection really early on, you might not even have 7, 8 years left, which doesn't make it really easy to commercialize that product later on. So if you have very short amount of time. But then if you really wait for a very long time, then you risk your invention. Someone can apply for a patent, or someone can just publish that before, before it's the science, right? Many people think about same things because we go to the same conferences, we read the same papers. So many people are thinking about related things. And just something very similar might make your patent application. You lose your novelty, you might lose your inventive step. So your initial application is very important, but again the timing of that is very important. In our case, what did we do? We have waited till we had our seed investment. Right before we signed for the investment, we did the patent applications because that was one of the requirements. We had to have protection, but the initial application was only done immediately before our seed round of investment. So we waited, you can say that we waited till the very last minute for this thing. The medicines we are working on are global medications. It's not just for Turkey. They will work for oncology patients everywhere. So we went very big on protection. Currently, our original patents that you were talking about are applied for in 58 countries in total. All over Europe, US, you name it, from Asia to America, everywhere we have protection. Some are already granted. So we have set up a strategy to wait till the last minute so that we don't lose the patent protection time till we get to the market kind of idea. But in terms of strategy, I think that's one of the most important things. For each patent, it has to have its own strategy. It cannot be, one fits for all kind of an idea. So each one will have their own strategy.
So I assume you spend lots of time on patent policies as well. So if you make a comparison between the time you have to commit to your patent policies and the time on research and development, what would you say? Is it equal? Or I also would like to ask about the special challenges, if any, for the biotech products in building the patenting strategies, of course.
I see. In terms of timing, I think it is still the amount of time in the lab is much longer compared to patent timing. But setting up the right strategy takes a very long time. So as I said, it's not just one strategy fits for all of our patents. So for each type of patent, the original patents we have are umbrella patents. So I call them umbrella because it's a carrier, but you can attach a different drug molecule, a different targeting, and go for a different oncology indication. So under such circumstances, you can keep exchanging them. It's almost like building Legos. You have one platform, and then you can attach different colors of Legos, and you make a different medication with that. So you can utilize these for many different products. So a strategy that would fit for such a patent is not the same thing for an indication patent or a formulation patent or a specific single molecule that you are trying to protect, and you protect a little bit around that. Usually patents don't have single molecules, they have many different molecules, but then again, you're around that one molecule that you are really trying to protect. For platform patents, it's a whole different story. You are trying to protect the platform, so it is it's harder to write. first of all. It's harder to get granted, for sure, and it's harder to defend. But then you need to set up a strategy to be able to go forward with this, if that's what your aim is. So it took us a long time to be able to, set up the whole idea around this thing. I cannot say that it was difficult because they have biotechnology aspects, the patents. Biotechnology patents themselves have some kind of, hard pieces to handle. But having our original patents as these platforms where you can attach a biomolecule also on there, and you can attach the biomolecule from any kind of a connection point, for example. Even writing this on paper was already challenging. But then once you set up your strategy and system on how you want to handle this and how you want to protect eventually all of your possible potential products, I think it worked out fine. So I think our patents were harder to write and develop because they have very wide coverage. They're not just narrow patents where you just get for one thing or one family of things. Not because they were biotechnology related. Biotech fields have, of course, if you are trying to write something with RNA, something, many different biotechnology areas have different problems or different challenges of their own in terms of biotech, yes.
And I know that, I mean, as you just explained, that your work is currently focused on treatment of cancer. Although I also learned that cancer is not a single disease and it's complicated. But is there any other area that you have in mind or plan to focus on in the near future? Maybe it may be related with cancer, I do not know, but it may be something completely different, but that will be maybe you will be using the knowledge that you gain through the cancer research, etc. But do you have any such plan?
So first I will start with the cancer area. So what we do is we have the carrier, we have the drug molecules, and we attach a biomolecule on top of these. The biomolecule is almost like writing an address on it to go not to a specific organ, but to go to a specific cell type. So that cell type, that cell has these receptors on their surfaces. It's almost like saying their mailbox in front of them, that my address goes and finds them. So it doesn't necessarily have to be a single type of cancer. So instead of going to one cancer, you could be going to multiple cancers with the same drug. So there are very few drugs like this in the market. They are called agnostic drugs. From the get-go, from the very beginning, you actually think of them as multiple indication targeting drugs. Not just the drugs that you start with one indication, one disease, and then develop further to affect another disease, But from the very beginning, you say, hey, this is a molecular disease, and I can attack them molecularly in multiple diseases because I recognize the cell. So the drugs that we are working on right now, we are hoping that they are going to be agnostic because they have shown their agnostic potential in animal experiments. So we are hoping that it will be like that in human as well. Now, I will explain two ideas, what we are trying to get to eventually. One is we are trying to use now these platforms for diagnostics as well. Diagnostics being many people I'm sure have gotten an MR in the hospital or a PET scan in the hospital. So you can have a little label on your system that is targeting the disease, and you can directly go to that disease site and figure out two advantages of this. One, you can have earlier detection, and which is a very crucial thing, especially in oncology. The earlier we can detect something, the better we are at in eradicating the disease in this case. So we are very interested in developing our platforms into diagnostic platforms as well currently. So that is one area we are working with. The other area is, I will explain it a little bit more generally. So what we do is you take a small molecule drug and you attach it to our carrier. What it does is it changes its water solubility, because your blood is water, right? So you want to make it water soluble, the drugs. It changes the water solubility and it changes how it behaves in the body. We call it pharmacokinetics technically. So what it means is it can stay longer in the body. So there are many drugs that will benefit from such a quality, that will stay a little longer in the body. Now, you are much younger, but many many people maybe in the audience will remember in my childhood, even antibiotics, they were given every 6 hours. Okay, you have little children, you know this very well. Every 6 hours means you have to wake up the child in the middle of the night, because every they sleep longer than 6 hours, right? So you have to wake up the child in the middle of the night and make them swallow an antibiotic. usually a syrup that doesn't taste very good. So now what happened? First they became every 8 hours, the drugs. Then they became every 12 hours. Now there are antibiotics that are once a day. So the formulations changed. We have gotten better in making these preparations. Not just us, I'm not talking about by we, myself, but the entire pharmaceutical field became better. So now you can just give a patient once a day drug. What does it mean? The half-life, the time that it stays in the body at that concentration that you need them, is now long enough for you to dose the patient once a day. So there are many drugs that can benefit from this fact that you want to dose the patient once a week. You dose the patient, less frequently, so that it stays longer in the body at a given concentration, slowly releasing the drug, and then you get a lot of benefit from some kind of a controlled release system like this. So our carriers are these platforms that we patented, can be used for practically anything. The first thing, of course, that come to our mind were oncology applications, because there is this immense medical need that you can solve bigger problems there. But there are many medications. Neuro is another field that we are very interested in and currently working in, that you can specifically deliver to organs like brain that is hard to get to, and that you can stay longer in a specific organ. And that doesn't necessarily have to be an oncology medication. Any kind of neurodegenerative disease medications will also benefit from the same idea. So the field is practically anything you want to deliver.
Yeah, wow. It's really, really brilliant. Well, I have another question, actually. I know time is a little bit off right now, but I would like to ask you about this, the award you received, your company received, the Grand Prix Award. It was not in the list of the questions that I shared before with you, but I really would like you to let us all know about what is this cleavable polymer drug conjugates, and why and how your company received a Grand Prix Award and then a silver medal on this invention. So can you please tell us about it a little bit?
So the polymer, that carrier technology, is that is one of our patents. The carrier, this is a water-soluble carrier in this case, and we have drugs attached to it and targeting units attached to it. So this whole thing, the umbrella that protects, is that patent. And that molecule, one of the molecules that is protected under that IP, is already in the clinic for non-small cell lung cancer patients right now. So that was a dream come true for me and all of my team, that we actually started the research and eventually made it to clinic. It is now benefiting patients. So the idea of applying for a patent and then eventually making a real impact, I think what was recognized with all the technology developments and everything, that's, I think, one of the important aspects of getting the Grand Prix award. Being the top award, top invention from the whole country and among many other countries. It was international awards, as a matter of fact, both of them. I think it was humbling. I really thought, like, oh my God.
Yeah, of course.
Like, out of everything you can imagine, it's not just pharmacy field, it's not medicine, it is everything and anything you can think of, like hundreds of applications, I don't know, thousands of applications in many areas, in engineering areas, medical field, energy field, anything. So the research and medicine research, getting it, I think it was, we were very excited about it.
Yeah, of course. Okay, now I have to come to the last question, I guess, because we may want to get some questions from audience as well. This one is kind of a classical one, but I think it's very important because you today shared lots of quite important information with us. You talked about the motivation, for example, or the feelings, you're not feeling, prevented from doing anything and believing yourself, etc. So I would like to ask, what would you advise to scientists or researchers following a similar path, especially in terms of intellectual property rights strategies?
I think I would just say, don't ever think that you know something. I think it's important to keep asking questions. I had many international patents before this current patent that we are talking about. I had applied, I had patents from US while I was working in US. I had patents after I came back to Turkey. But each patent or each patent family that you are working with has different strategies that you need to consider. And if you haven't done it before, or even if you have done it before, things change. The life changes in the whole world. New things come up. So it's important to keep asking questions and transfer knowledge and experience from other people, other ecosystems. In Turkey, we are not very used to the idea of applying for a patent and then actually translating it to technical use after that. It hasn't happened very many times, especially not in our fields. But if you are talking about more engineering fields, there are more examples. But from the pure science, really a pure scientific patent eventually becoming an application, we don't have a lot of experience in that. By we, I don't mean like myself or my team, but I mean the entire country. So I think what we have successfully accomplished so far is transferring knowledge from other ecosystems. That's why I'm right now in Switzerland talking to many people, not only patent strategies, but in clinical translation also. So how do people do these things and how they would view all aspects of the entire journey from the lab to clinic. And if you are really trying to copy something, it doesn't really fit you very well. If I look at very large companies or even small companies that have stemmed elsewhere in the world, I cannot just be copying what they have done and say, oh, they have applied for this, so let me apply for this country. It doesn't work out like that. So you have to really tailor it to your needs. So I think the biggest advice that I would give to myself, to 10 years ago myself, is don't think that you know it, because by then I had like some 30 patents. I thought I knew what to do. I didn't know. Keep asking questions to people in different lines of work, in different areas, in different parts of the world, I think is the best thing we have done so far. So I would advise that.
Well, quite an advice. Thank you very much, Professor Sanyal. Well, I know that you don't have much time and you're in a conference, so I will just look if there is any question from the audience. I'm checking. Okay, so I can see. Yeah, one question, if I'm not mistaken, but please, Dan, you can see more. If you see more questions, should help us with that. But I can see only one, which says that I think you have touched on this, but why are there so many successful female entrepreneurs in Turkey? I think we mentioned a little bit about this, but I will let you answer this question, Professor Sanyal.
I don't know where the question is stemming from as compared to successful female entrepreneurs percent-wise higher in Turkey compared to like Europe or compared to US in terms of percentages. Maybe that is the question, which is, I think, a correct fact. So the percentage of female entrepreneurs is less in US compared to Turkey. Female entrepreneurs in our areas is less in Europe compared to Turkey. So that might be where the question is stemming from. I think I'm going to give a very weird answer to this question. So when you think about the overall Turkey, like the entire Turkey, I think we have a lot of ways, a lot of hurdles to come over in terms of equality for women, education for women, for everything. We have a long way to go. But in terms of where in the science part, in technology, in science, when we are talking about already highly educated group of people within that family, let's call us, I don't really experience male versus female discrimination in Turkey. I lived in the US for 10 years. That was one of the most shocking things for me in the US. There is huge discrimination in Turkey against women. Again, I'm not talking about, you go to a remote village in Turkey and, different fields of life, different routes. But in terms of being in science and technology, I don't feel discriminated against. And I don't think I had any trouble because raising funds, for example, because I was female. I don't think in such level we have discrimination against females. So that is one thing that is, I think, different. I'm a little hesitant to say this thing because overall in the country, I don't think we are like, the average is lower than many countries. I accept that. But in the higher area of science and technology, I don't think I have personally experienced discrimination because I was female.
Yeah.
Maybe I was one of the lucky ones, I don't know. But I would have seen it by now. I have been in Turkey last 20 years, so.
Well, another question is asking that, have any of your patents are infringed? I may also add if any of them were subjected to the invalidation actions. Do you have any such patents that are infringed or tried to be invalidated?
Not yet. So there is a time frame when you have your application. I think you can explain this process much better than me. From the time you get your application granted, there's a certain period of time in each country. Some of them are a month, some of them are even 6 months, that they can be applied for invalidation, or they can be questioned again by other countries, other companies, for example, or other researchers. none of the countries we got grants, patent grants, have been subjected to such applications, not yet at least. When these drugs become really best sellers, billion drug molecules in the world, I think that's when it is going to happen.
Yeah.
So right now we are really under the radar for such things.
I see.
So not yet.
So another question is about what do you think about patent protection in Turkey? I may also add, do you trust that you'll be able to protect your patents against possible infringers in Turkey effectively, let me say?
That's a very difficult question. I have to say that. I don't know how to be politically correct about it. My original answer is yes. I think we will be able to protect within Turkey. We do have applications in Turkey as well. Some of them came directly from a Turkish patent application and then went globally. And then some of them went for global PCT applications or other EU applications, and then PCT, and then came back to Turkey. So we have both versions we have done so far. So out of those patents, I think if it is another Turkish company against what we are going through in terms of any kind of patent infringement, I will be very inquisitive in seeing what the courts will decide, because usually when it is a novel molecule, novel medication, it is always a Turkish company versus an international company. So it becomes a different issue in terms of pricing of those medications and everything. There are a lot of other things in play what they have to consider while deciding, not just the science part of it. But when it is two Turkish companies against each other, I don't know. I think science might win. I hope that science wins.
Yeah, of course. I also hope that. Well, from my professional experience, I can say that we have quite good provisions for patent protection, but sometimes, as we all know, that the interpretation of the judge may be different. But apart from that, we have really good grounds for the patent protection. It's all harmonized, as you also know. So there's a very good reason to believe in that there will be no problem, especially if we just want the science to win.
I have one little more comment on that. So usually when I see that there is infringement of patents in Turkey, it's not the original molecules patents or the novel new entity patents, but rather it is the fourth, fifth, sixth generation patent that is really protecting something very, very narrow in the formulation, something very, very narrow in terms of dosing, for example. So I don't think I would want to go that far down in narrowing things. When it is a novel molecule, it is not very easy to infringe as well. It's the novel molecule patents, the original patents that the companies have in terms of medicines. I don't think they all uphold very well in Turkey as well. So I don't think there is infringement of those patents. At least I haven't seen any, not to my experience at least. Maybe you have seen, but novel entity patents are, they hold themselves very well everywhere.
Yeah, if the patent is strong, then it sure has a better chance to survive, both from the invalidation action or to be successful against an infringer. It's for sure. But as I said, the legal background and the legal ground is quite strong in Turkey. Sometimes we have challenges in interpretation of law, of course. But apart from that, I agree with you, Professor Sanyal. It was an honor for us to have you today, especially looking at the title again, Women Behind Life-Changing Innovations. You were just right person for us. And thank you very much. I see some little more questions, but I think we have to close the session right now, considering that you're still in the conference. Thank you so much. It means a lot. Thank you for sharing all this information, and thank you for being the women scientist in Turkey and achieving all these brilliant things. We are really very proud of you and your team, of course. Thank you very much.
Well, big heart from me to all the IP team, your team that I worked with over the years, all the IP teams that I have been working with. Internationally, there are many women, I have to say, in many different fields. To the first person who wrote this amazing patent, Merve, big heart from me to her. So she became an amazing attorney over the years, and there have been many people that I worked with in terms of different patents, reading them, talking about them, evaluating them, and my own patents. Now trying to protect the research that we do in different countries everywhere. So many different groups of people have put their mind and heart into the IP part of it. And many different people put their mind and heart into really making this happen to clinic. There's an entire team who have been working last night till almost morning, who have been trying to purify the molecule that is going into the patients. There has been a team in the hospital today dosing a patient. So this is not a one-man show or one-woman show. It's not even a small group of people just in RS, but it is a whole group of people who have put their heart into this, that yes, we can do this. And I've been very blessed and very fortunate to have such amazing people in my life so far. So thank you for inviting me to share this journey.
It was an honor. Thank you very much. So we're saying goodbye to everyone for now. Thank you for joining us in this webinar. I hope you enjoyed it. I enjoyed it myself very much. And see you next year, hopefully, in the World IP Day. Goodbye.
Bye-bye.